Happy Tuesday, everyone. Welcome to, let me take a big breath. Which appliance should you use for which patients and which one should you absolutely avoid? Thank you for choosing to spend your Tuesday night with us and our esteemed panel. Before we introduce our esteemed panelists, though, I want to quickly share some housekeeping matters with you. Uh, CE is being provided by our CE partner at Spark Study Club. So, if you stay on until the end of the webinar tonight, you will receive in the next 24 hours an email from Donovan at Spark Study Club that will have your CE certificate. Keep an eye out for that email. It will not come from Jason and Transform Dental Sleep. It will come from Donovan at Spark Study Club. So stay on until the end, and then you will receive that email from Donovan in the next 24 hours with your CE certificate. Don't contact me an hour after the webinar asking where your CE certificate is. Okay, next. Down at the bottom of the screen, you can type in your questions. We have a few hundred people registered tonight, so there will be a lot of questions coming in. We want to do everything we can to get to your questions, so type them in at the bottom of your screen. And now, without further ado, I want to introduce our esteemed panelists. First, from the great state of New Jersey, said no one ever, is one of my favorite dentists in the world, Dr. John Carollo. Dr. John Carollo, you have lectured extensively and taught a zillion dentists everything they know about dental sleep medicine. So, what else? Where else have you been, and why are you here to share tonight?
Well, it's thanks for inviting me with the two other colleagues who are great colleagues and equally as experienced. So I've been doing dental sleep medicine for over 25 years, concentrating probably in the last 15 to 20, and then the last 2, 3 years, that's all I'm doing is dental sleep medicine. Um, why am I here? Well, I was invited first of all, but I think the three of us together will have a good broad opinion of what type of appliances that we like to do, and I've used pretty much a fair number of them, and also see a fair number of the ones that come into my office. So I think together we'll have a good perspective on helping you go through that, and not only look at the appliances, but how it fits the patient.
Perfect. And then next and thank you for being here, Dr. Carollo. And then next we've got pickleball player extraordinaire, Dr. Jason Doucette from Reno, Nevada. Jason, you are one of the kindest, most sincere human beings I've ever known in my life, and I'm so jazzed that you've joined us today. So tell everybody who you are, why you're here.
Well, thank you for the invite and the kind words. So yeah, I've been treating sleep since about late 2014. So what, 11, 12 years. Just like Dr. Carollo, I have been doing full-time sleep in TMD the last 2.5 years. We finally merged and built a new office just for sleep in TMD. So that's been exciting. Yeah. And then I taught for 7+ years, kind of across the country here and there for SGS, kind of sleep 101 and 102 to new dentists that wanted to get excited about sleep and get into it. And yeah, hopefully I can give some pearls tonight on our experiences and some opinions of, what's worked and what hasn't worked, depending on the questions you ask about certain appliances or certain situations. So we'll see what happens.
Fantastic. Well, thank you for joining us. And just a heads up to everyone that Jason, Dr. Doucette, is going to have to cut out in 45 minutes because he's got a pickleball league he's got to tend to. So when he disappears, it's not that not that our next panelist, Dr. Hedgecock, said anything wrong. It's just that he had to go.
That's it.
But Dr. Hedgecock, Dr. Brandon Hedgecock from Sleep Better Austin is a powerhouse with multi-state practice. How many offices do you have now, Brandon?
We're at 9 now.
9 offices, and how many states?
Just in 2 states right now, but we're getting ready to expand into some more.
Yeah. So tell everybody who you are and why you're here.
Yeah, home is Austin, Texas. I'm here because I love sleep and I love spreading the word and helping others love it too. Like Jason, I started in 2014 and done a bunch of coaching with people. But for me, really, the business of how to grow this bigger and help more people became something that really I latched onto. So that's kind of our focus now is just kind of how do we build more to help more people?
Fantastic. Well, thank you, all three of you guys. You guys have busy practices, busy schedules. Your time is in demand, and I appreciate you sharing so openly with everyone tonight. And with that said, type in your questions down at the bottom. This is a dialogue. These guys, between the three of them, have delivered I'm sure tens of thousands of devices, treated tens of thousands of patients, have bustling practices, and this is your opportunity. I see Jason doing the math there, trying to figure out if it's tens of
Yeah.
thousands. It is, yeah. But tens of thousands of devices, and they're here to answer your questions. We don't have any corporate sponsors or anything like that, so these guys are going to shoot you straight. And this is your opportunity to learn from their experiences so you can fast track your path to success and not have to kind of fall in any of the pitfalls or the potholes that they did. So with that said, John and Brandon, I saw both of you guys at AADSM. I know you didn't make it this year, Jason, but to you, Brandon and John, what kind of stood out as far as devices when maybe you're on the exhibit floor, the exhibitor floor? Anything jump out to you? New RPM02 was launched by ProSomnus. What stood out?
Yeah, I'd say that was kind of the buzz was the RPM02 with ProSomnus for me. We've been working a lot with that and I was part of kind of the beta testing group for that a couple years ago when they first were kind of launching the idea for it. And so it's been neat to kind of see them be persistent with getting this project through. And congratulations to Len and Sung and the team over there for many, many, many years of work and persistence to kind of get this through the FDA process. Um, that's probably what stood out to me the most was just that technology and where hopefully it's going to help take the field of dental sleep medicine.
Sure. What about you, John?
I'll piggyback off of that because that is probably the biggest buzz. And I had the fortunate opportunity to speak twice at AADSM this year. One was on sleep testing and data as a dentist on the pre-meeting, and then non-responders and responders. So we went through these appliances as because now the new wave is to track data. We know multiple night sleep testing is the best thing we can do. We try to do that for our calibration testing. Now we're going to be able to have that where and physicians can access the data. So that was huge. That there itself, and I'll talk a little bit more about sensors maybe later. But the other thing that I think came through for me was the amount of new until it gets changed, the new PDAC appliances that are out there. I saw 3 or 4 new ones that I didn't see last year. Sunny has a nice one called Kava.
Mhm.
It's soft and flexible like an Evo appliance, but thinner. Has a shorter arm, and he's learned how to tuck in the lower part of the Herbst in between 2 teeth so that he actually brings it into the lingual a little bit more. So that's kind of the 2 parts of the herps. The upper member is not as usually irritating the patients as the lower one. So I saw that. A couple other ones. There's some not new nylon ones that are coming out too that are not going to have a metal arm. So until AADSM gets their act together to try to get everything approved from Medicare or PDAC, we're still stuck with having certain types that we can deliver. So I saw a bunch of new ones, and some new ones are coming out.
Yeah, you mentioned Apex's Kava. Have you tried the ortho apnea device, John?
No, I haven't, but I'm trying this new nylon, another nylon from Diamond Lab that's got um, a different type of side that's tucked in a little bit. The orthoapnea is sort of similar to Panthera, which is nice, but it can stick out a little bit, but it's also good for lateral movement. So they all have their advantages. I used to always say we don't always try to pick one appliance. We got to have the patient's dentition and their situation and think and look at it and stuff. I'm a little different than some doctors. Some doctors show patients 3 or 4 and let them pick it. They're not the expert. I think we are. So I kind of look at their dentition and I'll show them a few, but I make the decision pretty much. I'm not trying to be, controlling, but I think I know what's best for my patient when I look at their dentition and the situations.
Sure, sure. With that, you alluded to this, John, that there's not one device. You've got several devices in your armamentarium.
Right.
But let's be realistic here, okay? Most of you have sort of a workhorse in your practice, right? Maybe a device you use not 100% of the time, not 90% of the time, not even 80%, but 51% of the time or more. Jason, what would that device be for you?
Oh, it would just be any type of Herbst, whatever company. I mean, everybody makes some version of it, right? So because for us, 30-40% of our practice, the patients have, are Medicare recipients. So we got to have PDAC, and then some other commercial insurance carriers require that as well. So that's just the tried and true. I don't think that's anything, groundbreaking to anyone on this, watching this, but yeah, and I'd say for us, it's probably 70-80%, of the time we're using some form of a Herbst for one reason or another, whether it's a bruxer that needs some lateral mobility, the PDAC requirement, you name it. And they're just a workhorse that's tried and true. There are a lot of other great ones that we do use when we don't have the handcuffs on us, quote unquote, with parameters. But yeah, that's it for us.
That's great. And, just something you said a moment ago, Jason, I just want to stress to the three of you guys. We've got so many people on here tonight that their experience levels run the gamut. So, kind of, thinking that everyone here has the same knowledge base just isn't the case. So
Right.
There are some newbies on here, some kind of neophytes. So let's just keep that in mind that, there's a lot of people that aren't familiar with the PDAC guidelines or
sorry. Okay.
Oh, that's all right. Yeah. But what about you, Brandon? What's the workhorse at Sleep Better Austin?
Yeah, I'd say our workhorse is probably the ProSomnus devices, and it's probably the Evo and kind of turning more into the guided and maybe the RPMO2. Like Jason, about 40% of our patients are Medicare or PDAC device required, but we work really hard. ProSomnus has done these studies, and internally we've tracked data over thousands of patients with the Herbst device versus with the Evo device. And the Evo consistently performs better. We see slightly higher success rates with the Evo. And so I don't have a problem telling the patient, your insurance requires this device, and I show them the Herbst device, and it's good. It works well. In our practice, it's maybe 65, 70, 75% success rate. But we know that in our practice, that Evo guided is closer to like 92%. We just see such a higher success rate with it. So we really give our patients the opportunity to get those devices and kind of upgrade to those devices or get a second device at a nominal charge, because it just makes the calibration process so much smoother, so much easy, so much simpler, less patient complaints, all of the things. And so we do a lot of the Herbst, but we also do quite a few Evo.
Got it. And what about you, John? What's the
I'm kind of in
workhorse?
line. I'm in line with Brandon. I'm probably over 95% using ProSomnus, and they have a few different ones within there. I mean, they have 2 different Herbsts. They have a rigid one and a more flexible Evo Herbst. The Evo guided is really nice because the post design we always say 70-degree posts are horrible because you can lose protrusion if the patient opens up and you don't wear elastics. This is a 95-degree post that actually helps with lip closure, and it really works well. We're seeing the same thing. So I do the same thing. I try to offer patients things. I mean, fortunately, I'm able to have in an area where we can do the same thing, offer a second device or give them that and then upgrade them to another device. And people are willing to do that. When you present it and you talk about the need for a medical position and not just a piece of plastic, they understand. They think it's just that's what it is, and that's not what it is, of course. And so, but yeah, the statistics do show that the herps isn't as efficacious as the other ones and all around. So we're leaning a little bit, and that's why, like I said, I wish, why is PDAC? It came out in 2007 or 8 that it has to be a hinged appliance, and then they finally let like Panthera with a nylon hinge, but it's stupid because everything should be no matter what you need. I'm on Medicare now, so I mean I'm older than everybody on this panel. When I had my knee replaced, they didn't say I had to have a certain one. I didn't have to have a herpes knee replacement. I had whatever my doctor wanted, and he picked the best. So they're not, and that's DME a little bit too. I mean, and I'm thinking, why they don't restrict the orthopedist, but they're restricting us. It's kind of weird. I thought about that when I had my knee replaced because I said, do you have to pick a certain one? He goes, nope, I'm going to pick the best one I know for you, and he did. But it's interesting.
John, you're a man that's well connected. I mean, is the ADSM
is that because my name ends in a vowel? Are you trying to?
Yeah. We won't talk about it. We've got our some omerta here, but I mean, you've got friends at the ADSM.
Yeah.
Is there headway being made with any of those discussions, or
they're trying? But I mean, look, I mean, every academy's got their own agenda, and I think ADSM and every academy's got things that they're looking to do. I think they're trying to grow it with membership, which is good. The more people out there, because if everybody who had sleep apnea was treated by just a number of dentists who are doing sleep now, we know that would never suffice. We need more people doing it. So I think they're trying, like Brandon says, let's get more.
I'm trying.
I know you are, and I think that's great what you're doing. And everybody else that's trying to grow the field is great, and I think we need to all do that. And I think the academy is trying to do that, but I think it's going to take a little bit more than just the academy. I think it was suggested once that if the 3 or 4 major appliance companies, along with the academy, tried to do this together, it might work. I mean, and it's changing. They're adding more and more. I bet you in the next 3 to 5 years, you'll see it pretty much be almost anything. That's kind of where it's going.
I think it's frustrating because we've got the K codes now. The K codes are approved codes, but there's no reimbursement for them. And so it's like, how long does it take to get the reimbursement for the K codes? And so, it's like this progress is being made, but it's just so slow and painful.
Yeah. And I mean, who's responsible for driving that forward?
Well, I do believe it's the academies and us as dentists itself. I think, like for instance, when a few states didn't allow, I'm still in one of the only 2 or 3 states left where you can't dispense a sleep study, as in New Jersey.
Yeah.
Unlike Texas, where you could do almost anything you want, Brandon. I figured that out.
With a gun on your hip too.
Yeah.
And
yeehaw.
So local dentists in Georgia and the Carolinas, they got together and they petitioned the state boards and they got sleep testing. We're trying to do that in our state, but it's like you said, it's slow, Brandon. It drags. So I think we all should try to get on the bandwagon together, as because we're all in this together. Every academy, yourself, Jason, with your great meeting, and AADSM, and when Kent used to do sleep roundtables and the pivot programs and Nearman programs and all the good programs out there have great benefits for the whole world of sleep. But I think if we can all try to put it together, maybe we can have more stakeholders having a better say.
Well, this conversation is taking a little bit of a right turn here because this is now getting into politics.
Sorry.
But the truth is that there's politics to this, and the people that are going to move this forward are going to be the people that pay the lobbying companies to lobby in Congress
Yeah.
to push this forward. And this may be the platform where if all of the dentists that go to TDS are willing to pay $1,000 a year, or $500 a year, or whatever that number is, to kind of put towards like a lobbying group. We've looked at it, and it's out of our budget a little bit because it's significant. But I think you're right, John. I think if we got enough people together that could all pitch in, um, you know, we could push some lobbying towards Congress.
I agree with everything that you just said, Brandon. Yeah. Uh, yeah, you know what? Let's table that for now.
Yeah.
Because
I think they want to hear about devices more important.
Yeah,
in
Sorry.
Arizona
They
next
think-
spring.
yeah. So I'm going to, it's funny, real quick. This is a topic, Brandon, that we really should be talking about, but I know most of the people that are on here don't want to hear about. They just want to talk about herpst arms and and anterior discluders. But you and I both know that this is critical. We can come back to that if we've got some more time, or maybe a future webinar. So I'm going to give you a device name, and I'll ask you guys to just share your thoughts, when you use it, when you don't, who you use it for. No, let me say that. Let's do this. I'm going to give some indications, and you tell me which device you would use. All right. So, Jason, heavy bruxer, lateral bruxer, big time bruxer.
Severe bruxer. It's probably going to be like Somnomed Avant.
Okay.
For sure. I've had some great success when traditional herps have been destroyed by a really heavy bruxer. But again, I'll just kind of default back to a lot of herp style appliances, a lot of give in those. But those are probably the two main ones for me.
Okay. So an the Avant allows full lateral range of motion. Yeah.
Kind of like a tap appliance. Now that I say that, a lot of patients don't love the tap because you're locked in. However, a lot of great lateral mobility. I don't know if they're that popular anymore. Most dentists that I've heard on webinars or talked to just don't use a lot of taps. But again, another tried and true as well. And it's PDAC approved for those of us that care or need to know that. So
sure. What about you, John? Heavy bruxer.
Heavy bruxer, I'm always going to look at, if the teeth are worn, I'm going to take lateral measurements besides the protrusive. I always do my lateral measurements. How far do they move? Because like Jason said, herps are very good. Yet I've had a patient break almost, a pit bull is going to break almost anything. I've seen them break herpst arms too. I actually go with now the older ProSomnus, like Evo Select, with a little offset post. So you can make the post, instead of coming up straight 90 degrees, you can have a 2.5 millimeter offset. It might stick out a little bit more in the cheek, but it's going to give you that 5 to 7 millimeters minimum of lateral movement. And they're pretty robust. They don't break. That's what I've used in some severe bruxers.
Got it. And then Brandon, what about with your Medicare patients? What's your go-to device?
Yeah, we're typically going to be a herpst device, and normally it's the Evo PH device
From ProSomnus?
Yep.
Okay. Jason, what herpst are you using most of the time?
Probably the Somnomed Elite. That's been a tried and true. I've used a lot over the years. Remember Spire Pink, you name it, even a Somnomed Flex, Herpst Flex. But that new proprietary. It's a little bit softer on the inside, harder on the outside. But that transition, the way those materials are put together versus the old days, has been holding up amazingly well. We get super great retention, strong. There's some give to it, so comfortable. But yeah, that's probably it. And then the other one lately actually is Great Lakes. I don't know if anybody else makes this, but it's a printed nylon appliance with herpst arms, the traditional herpst arms.
Serena just came out with one. I just saw at the meeting. I told you that. So Serena's got a nylon with nylon button, but a metal herp arm too. So yeah, that's
Awesome. Yeah,
similar to the Great Lakes one.
And
same.
I'll,
And that's another great lab that I love as well. Serena's a great one. So yeah, any
Sure.
those new nylon ones that seem to be pretty sweet as far as thin and not too bulky and a lot of give and strength to them.
Yeah, I'll go back and say that there's a handful of our patients that are Medicare patients. If dexterity is really an issue, they're not going to be able to see the little hole to screw the herb arm or something. We'll go with like a Panthera classic device that's a little bit easier, metal free as an option as well. So that's probably our two most common for Medicare.
Got it. And while we're talking about herps, hey, Julie, I see you. Uh, how often do you use elastics? How do you determine who you're using them for? Um, yeah. What do you got there, Jason?
Yeah, so usually right out of the gate when we deliver, I'll ask the patient, do you experience dry mouth a lot when you sleep? Which tells me they're probably either mouth breathing, and we need to make sure their nose works good. So if the nose is patent, works good, and they complain of dry mouth, then right out of the gate we're probably going to give them elastics to try. Or if the patient comes back for some follow-ups and they're not in elastics and they come in still saying they're still snoring and we've got them advanced where we want them, and or dry mouth, again, that's an indication for elastics for us typically at that point. But not everybody needs them, obviously, and we don't use them on everybody. So
What about dexterity? Maybe an older patient that might have some issues with the elastics. Is there,
chin,
an
yeah,
alternative there, or what do you do in those situations?
yeah, one of those massive zip ties from Harbor Freight or a big old Velcro chin strap, and then their spouse can put it on and take it off at their will. To be honest,
Yeah, got it.
but yeah.
All right. Lindsay has a question. It's tangentially related, so let's roll with this. Brandon, what type of monitor, if any, are you using to aid or dial in calibration prior to the actual follow-up study?
Yeah, that's actually a great question. We use the Sleepify devices,
Uh-huh.
and it's a home sleep testing device. We have patients wear them for 60 days, or we try to get them to wear them for 60 days. So the first 2 months that they're wearing their device, they're wearing that, and then they're switching out their devices along the way. And because it's a home sleep testing device, we don't have to like have a separate study. Whenever we have one that we like, we just have the sleep physician read and interpret that one, and that becomes our efficacy study. And you can use that to have RPM codes and do monitoring for patients as well, and you can see the night to night. The trouble with that is some patients don't wear it consistently. Some patients do, some patients don't turn it on right, or you don't ship it back. And so that's where this RPMO2 I think is going to be super valuable with calibration is if they're wearing their device, they're wearing the monitor. So we're starting to do a lot more of those. And it's going to save us some time and money without having to ship out the Sleepify units.
Sure, sure. And with the RPMO2, uh, it costs a little more, yes, than the similar ProSomnus device. Um, is there patient pushback? Is there insurance consideration? What else goes into making that decision? Because the technology and the indications for use seem pretty damn cool, if I may say so.
Yeah, I think it's just about educating patients. And if patients know what they're getting is worth it, and if you're just charging a little bit extra to cover your extra costs for it, it's not that much more. We let patients pay that at $50 a month if they want to. It's like, hey, if you want to get the best device out there and you can pay us $50 a month for the next, 6 months, you can get it or whatever it is.
Sure.
Um, and I think a lot of patients want what's best, and they see the savings in terms of time and It's less complicated for them if they don't have to do the home testing with their finger and the band on their wrist and all that kind of stuff. So I haven't had a lot of pushback. Most of our patients are like, yeah, either I want it and I'll get it, or no, maybe later.
Yeah. In my experience, also similar to what Brandon's doing, I talk to the patient, and especially if they're really having big oxygen drops and the percentage of night below 90 and they're severe, and I'm going, look, if you and a lot of my patients come to me because they're CPAP intolerant. My practice is probably 95% physician referral. So I said to them, when you had your CPAP, you were able to see how many events a night you're having. Isn't that great that we can now have something similar to do that? And that's one of the biggest things our sleep physicians wanted, that they could say, hey, we couldn't see the night to night data, and now we have that for you. And then I look on their wrist or their finger, and half of them are coming in with a wearable. And it was a great lecture on the pre-meeting. So what I think about, I tell my patient, look, whatever you're charging, like Brandon says, a nominal fee just for the cost of the thing is fine. If that's how you want to do it, I charge a little more for that. But I always look at it over, I take whatever number it is. If you want to say if it's $500 or $1,000, I divide that by 5 years and 365 days that they're going to use it. And it comes out to pennies a day. And then I'll go, you just bought an Apple Watch or an Oura Ring. This is going to be for your sleep every night, and it's actually less expensive than the device that you just put on your wrist or your finger. And people go, sounds like a plan, Dr. C, let's just do it. So yeah, you get less pushback when you explain the value and that it's really not that much per night, because we know that the standard insurance companies are not going to pay for a new device for 5 years. And so I do that math and they go, wow, you mean it's only 35 cents a night extra to have that? I go, yeah. And it's unbelievable information.
Sure. Totally makes sense. John, what about there's, one of the things I hear so often about nylon devices is how accurate the fit is. But I know there's also some concerns around adjusting those devices, particularly if patients got some pending dental work, some restorative work. How does pending dental work factor into your decision-making process with appliance selection?
Yeah, first of all, I'd like to have the dental work done ahead of time, but that's not always, perfect. I mean, so I'll try to do that. I sometimes make a patient a temporary appliance if they only have a little bit of dental work to do, or if they have severe dental work, I'll insist that they maybe stay under CPAP and just till they get their, like I have a patient that's doing full mouth upper and lower implants, and so we don't want that. But the nylon, getting to the nylon, I think everybody, Jason mentioned he likes the Serena. In my experience, some nylon appliances just fit over the teeth and they don't really engage them, and you could get some tooth movement. Whereas some of the nylon, like the Serena, actually has a better fit. And so you're going to see less tooth movement. But what we do in our take home things is we tell our patients, because some of them are not dental patients in my practice, and Jason and Brandon are not doing as they're doing more sleep and TMD. We tell them, we have this beautiful scan of your teeth and we have a model. If you're going to your dentist, let us know. We can give you the model. A lab can actually scan, say, tooth number 19 on the preoperative model, or take my scan and make a crown almost to the exact dimensions of the existing tooth that they had, so that the nylon device needs minimal adjustment, which is easy to do. And you don't have that problem so much. And then there's special burrs for nylon. Actually, an interesting thing that was at the meeting, I know I'm not, I think I'm on the camera. If I put these, I don't know if you could see these things. Oh, here they are.
Kind of, sort of, there you go.
So these white ceramic burrs, they used to be like $50, $60 from Comet or Brasseler. So if you go on Amazon and look up nail, like fingernail, nail bit, BIT, 5 coarse, extra coarse, fine, medium, and super fine, $19 for 5 different ceramic burrs that I use to adjust my nylon.
Yeah.
Don't buy them from the dental company at $50, $60 a piece. You can get 5 of them for $20. And I could send you the link, Jason, if you want later, so that you could share it with the group.
Yeah, if you could.
Yep, I'll do that.
We'll get that shared with the group. Yeah. Excellent. Okay. I'm going to actually let's do this. Let's take a so real quick. Uh, Jason, last year you spoke at the Transform Dental Sleep Symposium. 2 years ago, JC, you spoke. Uh, John, that's not Jersey in the background there. That looks like the golf course at Kierland. Yeah.
Yes, it is
Mhm.
the new resort you're having it at. Which I mean, the other resort was always great, but now this is supposed to be a bigger, better venue because I think you're outgrown the other one, which is kudos to you and your team.
Yeah. Well, thank you, John. Thank you. Yeah, the 2027 Transform Dental Sleep Symposium, it's January 22nd and 23rd. It's in Scottsdale, like Dr. Corolla mentioned, moving to a new, larger venue. The most common piece of critical feedback we got was just that we'd outgrown the venue. And we were getting that feedback after the first year. And we continued to grow year over year. After 3 years, it was a matter of either shutting it down or moving to a larger venue. So we're moving to this new resort. It's in Scottsdale. It's beautiful. It's 15 minutes or so from the airport. You can register at tdssymposium.com. There's just a smattering of the speakers right there. We're adding new speakers each week. On our next webinar, we'll be announcing 3 more new speakers. So stay tuned. But yeah, the focus really is on practical lectures, practical topics. And, it sounds corny and cliche to say, actionable information you can put into practice on Monday. But really, that's what the focus is on. It's on giving you information that you can take and put into practice. So, yeah, we hope you'll join us in Scottsdale. Also, our friends at Pristine Medical Billing are sponsoring a golf outing the day before. So Thursday, January 21st. It is limited to only 30 golfers. I know our friends Ashish Patel at Panthera and a couple of others will be sponsoring some holes. So it's going to be a blast. It's going to be a blast. I don't golf, but I'm sure people will be in terribly tacky golf clothes, and it's going to be a lot of fun. So shout outs to our friends at Pristine for sponsoring that event. It does require separate registration. It's limited to 30, so get signed up. And then another thing I want to mention is Sleep Intel. So Sleep Intel is an online publication that I started in January. I'm going to give you a real quick commercial for it because I don't think a lot of people fully understand what it is. In the past, I have been editor in chief of some online sleep magazines. So, those sleep magazines you get where it looks like a magazine, you turn the pages and it does the little sound effect, that's my ASMR for you. It does that little sound effect when you turn the page. And when you try to zoom in to read the stuff, it becomes hard to read. And then you try to turn the page. It's just, they're kind of unseemly and unwieldy to read. And then you get this thing delivered to you that's like 80 pages, and you're not going to flip through 80 pages on your laptop or your phone. So instead, I started Sleep Intel, which the idea is that it's like an online publication, but instead of sending it to you in that format, we publish 2 or 3 new articles each week. If you scan that QR code, you can subscribe right now. There are options to subscribe for free, and these will be delivered right to your inbox every, 2 or 3 times a week. There are some paid options. What do you get with a paid option? You get, I think, some Transform Dental Sleep merch. You also get access to some articles that other people won't get access to. They're hidden behind a paywall, but it really helps to support our efforts. We're giving you information that's really unbiased. It's from everyone from entrepreneurs to RPSGTs to dentists to sleep physicians. It runs the gamut. And we're just trying to keep you informed of what's going on out there. So go to sleepintel.net to subscribe or scan that QR code. I see if three of you have just subscribed right now, so thank you. But get subscribed. It'll keep you apprised of a lot of what's going on in there. Or don't. I don't care.
Yeah, I mean,
Whatever.
I mean, just to echo that, I mean, I'm a member of it, and I'm working on something for you. I told you after AADSM when I had some free time, I'm working on stuff. But I got to tell you, you got a good variety there, and some good pearls every week. You get some new insights, so it runs a good gamut, like you said. I think it's got a nice diverse uh, followership.
Well, I appreciate that, and we're always looking for new insights and new content. So, if someone out there feels you have something that the world needs to know about, give me a shout, and let's talk about the possibility of getting an article together. All right, let's dive back in. So, there are a number of questions coming in about TMD. What appliance do you recommend for a patient with TMD? I see Doucette, just our resident TMD expert, going, "Oh, geez, Louise." But Jason, I know you got to get some pickleball, so I'm going to hand this
Yeah.
baton to you. So
Okay.
TMD, what should they do?
So as far as, I mean, typically a lot of patients require some type of daytime appliance, right? Or we got to put the mandible in what I call like a therapeutic position, or it's a slightly down and forward to get the discs on the condyles, whatever, eliminate posterior compression of the tissues. For that, typically I've found Sonny at Apex makes an amazing, I mean, he makes a number, like his whole background's in TMD before sleep, which is really cool for that end for me. And so he makes a number of different daytime Gelb style advancement. You've seen a lot of them, whether it's the acrylic with the lingual metal bar over the posterior teeth. But I like the actual, it's a suck down type of appliance that's clear that fits over the lower arch like an Invisalign tray. That's a repositioner that they add clear acrylic to. So that's my favorite, that patients tolerate the best and seem to not even mind wearing. And then typically also for TMD patients, a good percentage of them, if not 70 to 80% plus, they have some type of sleep disorder breathing issue that's either causing or exacerbating these TMJ or TMD symptoms. So again, that lends to, we sleep test every patient in the TMD side. And then typically we have them in, one of the number of appliances we've talked about. But traditionally for them, for lateral movement, comfort, and things like that, adjustability, I'm putting a lot of them in herb style appliances if they have some significant sleep disorder breathing. If they don't, and it's a UARS where there's a little bit of, a very low AHI, maybe a high RDI, we just need a little stability, then I'm using a lot of EMA type of appliances, but lately Airvada. I don't know if you guys out there have heard of Airvada.
Mhm.
Again, a kind of a printed nylon with some really forgiving bands that will stabilize and kind of cushion that mandible at night and stabilize that airway. But again, that, whatever works in others' hands, and EMA works great as well. But that's typically where I'm going for those UARS patients at night. But if they have full blown, significant OSA, now I'm looking at a number of appliances. It could be an Evo, it could be an Herbst Elite, you name it. So sometimes an Avant, but that's a little more rare for the TMD patients.
Got it. What about you, Brandon?
I refer all my TMD patients to Jason Doucette.
Yeah, I was gonna say almost.
And Jason's like, "I've got patients that come from all over Texas to my practice." Yeah.
No, we most devices for the sleeping side of things, most devices help patients feel a little bit more comfortable because it does exactly what Jason said, which is it takes the pressure off the condyles and the posterior tissue by positioning them down and forward. If they have super limited range of motion, hot muscle palpations, like if it's an active TMD type scenario, we would consider doing like an anterior discluding element on an Evo Select or something like that. If it's not like an active acute TMD type scenario, we just use kind of our standard protocols.
Okay. And Jason, I know
Yeah.
you've got some pickleball to tend to.
Yeah.
Before you jump, would you mind just impart one pearl on everybody tonight? What would it be?
Oh gosh, putting me on the
Go.
spot.
Yeah.
Uh, well, for those TMD patients that you have a daytime appliance in, if you're getting relief in the joints, but they're still having daytime clenching symptoms, something I learned was to cut off the posteriors of that appliance to eliminate that proprioception in the posterior. It can work wonders. It's not 100%, but 90% of the time. Huge savior for those clenching patients in TMD.
Got it.
And
Thank you.
and let me add back
Yeah,
to
please.
circle with the symptoms. So I agree with Brandon. So before I got into TMD, you find that again, there's a lot of sleep disorder breathing in TMD patients. So a lot of times you can even start by treating someone with sleep. And there's a good portion of those where the TMD symptoms will actually resolve just by treating the sleep. And then if it doesn't, you can always add the daytime therapy or phase two, whatever you want to call it, to treat that overall patient. So that's another pearl there. But they're highly connected, is where I would like to impart that to a lot of people that are maybe thinking about dabbling in TMD, or they're nervous about treating sleep with TMD symptoms, because the insurance companies and some docs will say these appliances might aggravate or make that TMJ problem worse. That's possibly true in the human body, but 98% of the time it's not. It actually helps resolve those issues by treating their sleep. So
Fantastic.
that's it. That's all,
Fantastic.
folks.
Yeah. Well, thank you for
Thank you
sharing
for
with
the
us
invite.
tonight, Jason. Yeah.
All right. You
Good
guys
Good
have
luck.
a good night.
Good luck in your
Okay.
game tonight.
All right. Thank you. See ya.
I don't know if that's the right terminology. Well, oh, he's still on. I don't know if game is the right terminology for pickleball. If it's like match, I don't know what it is.
It's probably match. Yeah.
Okay. All right. Okay. What about uh? Let's talk about. Can we talk about nylon devices a little bit? Is Jason just stuck there? Okay, there we go. Let's talk about nylon devices a little more. So, Good Sleep Co. has an Avera device, Panthera, of course, and then we mentioned Serena and a couple of others. Um, is there one design that you prefer over the others, or that you use more frequently than the others? And if so, why? Either one of you guys. It's a jump ball.
All right. 2013, I switched a lot from acrylic to nylon. I used to be a speaker for Panthera. And then I found out, again, not knocking any company, they've improved their appliance so much.
Sure.
It wasn't covering engaging the teeth. They actually used to have a strap, which you had too much tooth movement. So they've corrected all that. I'm not a big nylon person anymore. I see too much problems with some of the nylons. I think they're very light and thin. Some people swear by nylon. I like I think Brandon and I are both using more Prosomnus in our practices than most dentists. Nothing is as good as a medical grade 6 material that is just the only proprietary material that's made out of that. That's the only company that has that. I see a lot of staining buildup and stuff with some of the nylons, but I think nylon has its use for patients. I think you need to try them. You asked for a pearl, I'll throw a pearl out. I think you should try one in yourself. If you're going to switch to say, let me try a certain type of nylon, because you can get nylon with EMA straps, you can get nylon with Herps design straps, you can get nylon with, like he said, this Airvada, which is almost like an EMA strap, but it's got a double hinge and it's a nylon strap. So before you jump into trying them on patients, try them on a family member or staff member, make one for yourself. Most of the appliance companies are willing to say, hey, let me try making one for you. I just was at the Serena booth and they said, Dr. C, we'd love for you to try our new device. Let me give you 3 free. I mean, now, yeah, they look at us different because we're key opinion
If
leaders.
any of those guys are on here right now, they're going, "Shut up, Carollo, shut up."
No, but I mean, they will make you a free appliance for yourself to try. I mean, Brandon, you've tried different ones on yourself, haven't you?
I've tried a ton,
Yeah.
at
So I think
at least
yes.
30.
Yeah. So I mean,
Yeah.
I think that's a good thing because I've tried a bunch myself too. So
Yeah.
I mean, that's something to think about for any of the nylons because they all have the fit is one thing, but the mechanism of action, how it's going to keep the jaw in a position is different. You mentioned that orthoapnea. I know a good friend of mine uses a lot of it. He speaks for them. I never made one, but I'm going to try. I think it looks promising. With the, have you made any of those, Brandon?
I haven't done any ortho apneas. I have done, speaking of nylon and what we have done, Serena, when they first came out, I liked the idea of how they were changing out the trays similar to the Prostomnus ones, but I didn't really like the vertical that they add those blocks on the vertical. It opens you up more vertically. And I found with my own that I kept getting disengaged if I didn't wear elastics. And I don't want to wear elastics because I'm lazy. So I kind of fell away from Serena. Good Sleep Co. I think their Hushed Avera actually fits really nice, and I like how much space it has for the tongue. It kind of opens in the front a little bit more, and I feel like my tongue has the ability to position forward a little bit more. So I've had some good success with that. It's comfortable. And the patients who just are really the Medicare patients who are like, I do not want metal. That metal looks scary. That metal looks barbaric. Then we have this nice lightweight Panthera option to for them to use, and they like it because it's not metal. So that's where a lot of our patients are kind of going that way. But I'm with John. I think from a material standpoint, I like that medical grade 6 plastic.
Yeah.
Got
The
it.
other thing, just for any appliance that you get back, I think if you spend a lot of time, I think you, Brandon, and I know Jason does, he uses the pharyngometer still to figure out his vertical and horizontal position, is that to check that the appliance is actually made to what you did. So if you're going to use a certain amount, and there was some new George gauge that was just shown at the meeting that actually has a jig to set the vertical at 4, 6, or whatever. And if you're using a George gauge, so it's a new George gauge that I just saw at the show. But if you can get an appliance back and it's not made to the standards of where you picked, then you're going to starting off not where you want it to be. And then you're going to chase calibration or titration, I think. So I measure all my devices, and they should. And some of the companies today are really good with all the digital workflows, but you're going to find one or two that I went one time. I tried a new appliance and it came back 5 millimeters off. Like you said, it's open. They opened the vertical. They should never open the vertical without asking you. And so those are things that you make sure you tell a new person. If my scan doesn't have enough room for your specific material or device, that's fine. Let me know, and I'll let you know if we want to change that vertical or not or something, because you should get back what you sent out and not something where they make the decisions on. So that's important for me.
So two things. Dr. Lawrence, again, high five Dr. Lawrence for recently attaining her diplomate, the ADSM. Congratulations. She said that she's going to reach out to Prosomnus and tell them that Dr. C said she should get a free appliance for herself. And then also you opened it.
They might make you free one. I'm not sure.
I mean, there was no might earlier. Now we've got this hedging, language. But also you've opened up a can of worms. My friend Ashish Patel at Panthera said that they will happily make a device, a personal device for any dentists that are on here. So reach out to Ashish and also reach out to your Prosomnus rep, and you could tell them all that Dr. Carollo sent you.
Yeah, they're going to send me the bill, and I'll pass it off to you, Jason.
Yeah. You'd be like, this is the most expensive donation of my time I've ever given.
Mine too.
Yeah, so there's a lot of questions that are coming through about RPMO2, and I know certainly, the aim isn't to make this a commercial for any device, but a lot of the questions are kind of centered more around or more on, what do we do with this data? What is provided to the patient with the follow-up regarding who's monitoring this data? What are we doing with this data? Or are we monitoring it just for funsies?
No, so the data is helpful with titrating the device. The data is helpful to see if patients are, effective in their treatment from night to night, over multiple nights. And so, as they calibrate and change out their trays, you can see, is their ODI improving? Is it going up? Is it going down? Um, and if they get to a point where they're good, and then all of a sudden you see the data starts to show that maybe they're not good, did something else happen? Did they change their pillow? Did they, get a cold? Did they, revert back to a different device because their jaw was hurting? And it gives you the opportunity to talk to the patient and communicate with the patient. It doesn't take a long time to review the data. Your dashboard brings it all up relatively quickly. You can go individually into each patient and see it. We have a team member whose job is to kind of monitor that data. And so obviously this does take a team. If you are just a dentist in your dental practice and you think that your dental assistant's going to be good for this, I'm telling you right now, they're not. If you're going to do any sort of volume, if you're doing one patient a month or so, then sure, you can have somebody on your dental team do it. But if you're doing any sort of volume of this, you're going to need to kind of build some workflows around it and have the personnel to watch it. More importantly, though, than just being able to view the data yourself and titrate patients accordingly or have these conversations with patients and the success is the ability to take that data and also show it to their cardiologist, also show it to their pulmonologist. They can actually get access to their patient portals to where they can log in and see the data because they do care what their heart rate is doing. These cardiologists care very much about what their heart rate is doing and what their oxygen saturation is doing overnight.
Yeah, I think to echo that is everything you said is spot on. I think the physicians. I think this is so early, Jason. I mean, you got to remember, it just became an RPMO2 where you have the remote patient monitoring. So it's so new out there that none of my physicians are really on board looking at it regularly yet. I think as we see this in the next 4 to 6 months, 8 months, we'll see more of how the physicians are reacting to this. It's the only player right now. But there's about three other companies that are working on sensors.
Yeah,
Um,
SomnoMed's got something in the hopper, I think, right?
Somnomed has it. There's another one called Tessa. There's another one from Dr. Reza. He's got one that's coming out. I actually spoke to him right after AADSM because he heard me speak, and he asked I showed all the ones in my lecture that are out there, but they're all being functional. The problem is, and I also talked to Scott at Somnomed. They had a couple of setbacks with some of the testing and stuff, but that's all going to get worked through. You're going to, just like you see all the companies making a herps and the companies making different dorsal designs. You're going to see different players coming out with sensors. They might not all have the exact same capability as the RPMO2 right now. They might just be more compliant sensors. They might not have that other RPMO2 status, but it's going to be good for the industry. I think this is moving the industry forward, and they're first ones to really spend. They spend a lot of time and a lot of money,
Yeah,
and a lot.
yeah.
And I hope they benefit from it. And I think we all as sleep physician dentists are going to benefit, and our patients ultimately is the best benefit.
Sure, sure. Yeah, I mean, certainly, look, whatever device you use, or whatever company allegiance you have, I mean, credit where credit's due. ProSomnus dedicated a ton of resources to developing this technology, and it certainly helps to move the industry forward.
Yeah.
And I commend all the other companies that are also developing their own technologies. And I would hope to, piggybacking on some of the earlier conversation, I would really hope to see more solidarity in the industry. Um, yeah, sure, he can, compete for market share, but at the same time, let's grow the size of the overall market. Um, there aren't enough dentists to make a dent in this problem today. Um, with that said, we've got a bunch more questions, but we're running out of time here. Quick thing on the CE, one more time. Or actually, before we talk about the CE, our next webinar is a month from now, June 16th. We've got Dr. Nicole Chenet and Dr. Ryan Seuss, who is an ENT, both in the Pittsburgh area. They're going to talk about how an Inspire surgeon and a dentist can collaborate to deliver the best patient outcomes. So, how do they work together so that these patients that come to see Dr. Seuss for Inspire get the best treatment possible? So many dentists look at Inspire as some sort of competitive treatment modality. In actuality, what you'll hear here is it's a great opportunity to coordinate and actually deliver more oral appliances and help patients get the treatment they need. So sign up for that webinar. That's June 16th at the same time. Also, uh, got a a podcast with Dr. Aaron Elliott. We've got a new episode coming out tomorrow with Ryan Javenbach. We've had Dr. Hedgecock's partner, Max Kerr, on a couple of episodes, but we put those out every other Wednesday. Check that out at sleepmatterspodcast.com. New episode tomorrow with Ryan Javenbach of sleeptest.com. And then your CE will be delivered to you in the next 24 hours from Donovan at Spark Study Club. Shout out to Spark Study Club. If you are hosting a CE event or conference and you need a CE provider, I can attest to the fact that Donovan and his crew at Spark Study Club do a bang up job. So keep an eye out for that CE certificate in the next 24 hours. And once again, get registered for the Transform Dental Sleep Symposium in January in Scottsdale. It will be bigger and better than ever. You will walk away. If you incorporate just 10% of what you learn, you will have a busier, more successful dental sleep practice. I guarantee you that. All right, let's jump back in. We're going to run through these questions really quickly. Actually, for anybody that's got to jump off, we still have over 100 people that are still on here. If you've got to jump off, cool. You will get your CE certificates. Thank you for joining us. Your commitment to dental sleep medicine, to your patients, your practices is admirable, commendable, and we appreciate you. Okay. With CPAP, patients may have their CPAP taken away. Do you think if folks are not adherent to or non-responsive to oral appliances that their devices will be taken away? Oral appliances will be taken away. Do you see something like that over in the horizon, Brandon?
I don't, because it's customized. Nobody else can use it. The CPAP can be used by somebody else. Oral appliances can't. And also, compliance is much higher anyway. So it's not as big of an issue.
Got it. John, you mentioned earlier a George Gauge type device earlier that is not just AP but VDO as well. Somebody wants to know about adding vertical to improve the efficacy of the device. How do you know when to add vertical? How do you know how much to add?
Well, some people are using the EchoVision system for that. I really don't use that much anymore. If you add too much vertical, you actually lose protrusion, so you got to be careful. I don't think a protrusion vertical is really as indicated as much as I used to think. I still think it has its place. I look at range of motion. If a person's a severe patient and with a big tongue, and they can only move their jaw 6 millimeters forward, that's less than my ideal. 7 is my minimum. So I might start them out a little bit more vertical. You can always cut it back. It's hard to add to it. especially when you're doing a precision appliance like ProSomnus, you're not adding to it. There are appliances out there. There's a nylon from Diamond or thought, or that you can add vertical. They can make it with shims on it in the back. So if you're nylon and you want to concern about vertical, and that's your stick, there's one or two out there. This nylon one has a little snap in thing. They can add millimeter vertical stops to that. So
Got it. John, also, you mentioned earlier occasionally using a temporary device.
yeah.
If patient has some pending restorative work, is there one that you recommend over another?
Yeah, I try to use something that's relatively inexpensive that'll last. Um, Glidewell makes a Silent Night, which is a little cheaper, and it's like $200, and it could last for you know 6 months if you had to. Some people use that as their primary PDAC appliance. I don't think that's going to last 5 years. You can make an inexpensive EMA. One thing about EMAs, real quick. If you talked about bruxers earlier tonight, if you
Yeah.
make a patient an EMA and you got them in a strap that's 20 millimeters, they're going to stretch that strap out. So, Brandon said, what happens if they change with the ProSomnus? They're not going to lose their position. But EMA, they'll say, oh, son, I'm snoring again. I had a patient come in and the strap I picked was 20 for them in an EMA, and they came in, now it was stretched out 2 extra millimeters. So make sure you have enough straps on hand to change those on a regular basis because they stretch. And the same thing with Avant. That front strap, Jason says it's great for lateral. It does work and it's great, but those straps also can stretch. So, if you have a post appliance, you're not going to have to worry about things changing, or herps. Make sure the screw doesn't change on you, because sometimes they can, if you have a double lock, they don't change as much as the herps 10 years ago, because I've seen those change. But the strap types of devices can stretch. So make sure you're changing those pretty frequently to keep that actual therapeutic position that you worked hard to get.
Got it. Brandon, what's your fortune cookie words of advice to anyone that's on tonight regarding appliance selection?
Oh man, the appliances is just part of it. I think that just like any other procedure in dentistry, you want to be comfortable with the customer service that you get from the device manufacturer you're using. So if you don't feel like your cases are getting shipped on time, if there's delays in them getting to you, if they're not being coming back the way that you set them, if you can't, pick up the phone and talk to a technician or one of the specialists, if you've got a rep that, will not come see you versus will come and sponsor a dinner for some local physicians for you and things like that, those things go a long way for me. So pay attention to the customer service that you get, and I think that should be part of what impacts your decision on what type of device you use.
Yeah, absolutely. You need that support. I would say the same thing is certainly true of medical billing companies. It's like you can look at a lot of these devices and go, well, they're somewhat interchangeable, but service is a differentiator. Same thing with medical billing companies. So many of them are, apples to apples when it comes to the service they actually perform. But as far as communication and keeping you apprised of the status of your claims, that's really where communication and service is a differentiator. And it's the same thing to everyone on here who has a practice. Service is a differentiator. Um, you're not a commodity, and service is a key differentiation point. So keep that in mind. John, what's your fortune cookie word of wisdom for everyone?
So I think Brandon summed up the appliance thing excellent about the customer service. I think one of the things as you go forward and start doing more cases and you start looking into doing some of the more severe type of patients that don't always have a full response to it, don't rule out co-therapies. There's a lot of things that we should think about, like CPAP and oral appliance. I had a patient today, a young woman who she said to me, she's going back on CPAP because she had night sweats. And then I started talking to her. I said, I really think, you should talk to your gynecologist about hormone replacement therapy. She goes, well, actually, I went yesterday and I'm on the hormone replacement therapy. So she goes, you really nailed that one.
Yeah,
And I
yeah.
said, so night sweats are not always from sleep. They're, in her case, she was a female, so it was more hormonal. But CPAP therapy, I use myofunctional therapists a lot more now than I ever did in the past to help with tongue position. I had a lady today with an anterior open bite. I suggested her for myofunctional therapy. The Excite OSA then can help with tonality. So we're moving the jaw forward with a device, but something that can help create more muscle tone in the tongue, whether it's therapy or something like this Excite OSA, playing a musical instrument. There's lots of things. So I mean, you got that great lecture coming up. We talked about hypoglossal nerve stimulation, where they can work together, because the hypoglossal nerve does create tone strength. So we're strengthening the tongue muscle and not only moving it forward with a device. So concurrently, I'm doing more of these combination cases with hypoglossal nerve stimulation. So co-therapies could maybe another topic for you,
Sure.
nasal surgeries and things. So the pearl for me is appliances are great, but it's about getting the patient healthy, whether it's using a co-therapy or if they have to go back on CPAP, sometimes they have to go back on CPAP. It's about getting the patient healthy. That's it.
Well, I see Brian Shepard out there, Bruce Herr, Chad Wickow. We've been missing you out here in Scottsdale. Chuck Tozer, my man. Who else we got on here? Arella Rappaport, how are you, girlfriend? Gilles Levine. We got the big dogs in the house. Haley Lawrence, good to see Jim Goff. Janice out there at ProSomnus. Good to see all you guys on here. There's a ton of you on here. JB, John Bozis, Julie Herndon, all of you that are here. Thank you for joining us. Oh, Mike Murray, what's going on, my man? And Preeti, Paulette, thank you all for being here. Seriously, your commitment to your patients to be here and learn on a Tuesday night, it's really admirable. Thank you. I hope you found this useful and you'll join us for our next webinar. Brandon, John, Jason already had to go, but both of you guys, I mean, you get paid $1 zillion to lecture, and the fact that you were willing to be here tonight and share your time and experience so openly really is a testament to who you guys are and your willingness to help others, help more patients is a blessing to all of us. So thank you. And then to all of you that are on here, again, thank you for being here. I hope most important, you take this information and you do something with it, right? Don't let this just be knowledge. Use it, put it into practice and turn it into wisdom. And look, I don't have anything to sell you. I hope you'll come to Transform Dental Sleep. But if you need anything, if you need some direction, you have other questions, just give me a shout. I'm happy to point you in the right direction. I'll help you out any way I can. And thanks for being here, everybody. Have a wonderful evening and take care of yourselves. Take care of each other. Thank you all.
Thank you, Jason. Take care.